Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Today I will discuss about the brucellosis. Brucella is an important zoonotic disease. Brucellosis is a disease. The causative agent of brucellosis is called Brucella, which is a bacteria. And brucellosis also called the Banks disease, Crimean fever, Gibraltar fever, Malta fever, Maltese fever, Mediterranean fever, rock fever, or undulant fever is a highly contagious disease caused by ingestion of unpasteurized milk or milk products or meat from infected animal or close contact with their secretions. Other names for brucellosis like undulant fever, Malta fever, Gibraltar fever, Mediterranean fever. The term zoonosis describes that diseases which transmit from animal to humans is called zoonotic diseases, and Brucella is a zoonotic disease. Brucellosis disease of domestic and wild animals. It transmits from animals to human. It has a different non-specific symptoms and signs. Bruce was one of the scientists who for the first time isolated Brucella melitensis in 1886 from the spleen of Malta fever victim. Spread of brucellosis. There are there are some species of Brucella which directly transmit from animals to humans, like Brucella suis, which transmit from pigs to humans, which is highly pathogenic. And another one species is Brucella canis, which transmit from dog to humans, and its moderate pathogenicity. The third one species of Brucella is Brucella abortus, which transmit from cattle to humans, and it has moderate pathogenicity. The Brucella abortus also causes abortion in cows. Fourth one species of brucellosis, Brucella, which cause brucellosis, is the Brucella melitensis, which transmit from sheep to humans. It's highly pathogenic for humans. And brucellosis in humans, brucellosis usually associated with the consumption of unpasteurized milk. And unpasteurized milk products like soft cheese made from the milk of infected animal primarily got infected with Brucella melitensis, and with the occupational exposure of laboratory workers like the researchers were doing research on the Brucella. And another one which more prone to expose to Brucella is veterinarians and the slaughterhouse workers. Characteristic of bacteria is the microbiological characteristic of bacteria. Brucella species will be small, gram-negative aerobic cocobacilli lacking a capsule, flagella, endospore, and natoplasmid. Biochemical test shows that it will be oxidase and catalase positive for most members of the genus Brucella. For research purposes, if we culture it on media, so there will be carbon dioxide enrichment. There will be need of carbon dioxide enrichment for the primary isolation in the laboratory. The species Brucella melitensis, as I have discussed, that is principal hosts like goats and sheep, most pathogenic in human. Sporadic cases in humans in the US occur related to consumption of the unpasteurized dairy products from countries where the disease is present. Another one species is the Brucella suis. Its principal host is swine. Since Brucella swine is normally found in pigs, wild dogs, field swine, hunter are at risk of becoming infected when they field dress infected pigs. Another one species of Brucella is the Brucella canis. Its primary or principal host is dog. Individuals who are in close contact with dogs or breeders, veterinary staff who assist with the birthing at risk of becoming infected. Those persons, like the veterinarians and individuals who are in close contacts, are more exposed to the risk of becoming infection. CDC doesn't currently perform serological testing for the Brucella canis. Now, I will discuss about the mode of transmission, how it will transmit from animals to humans, like direct inoculation through cuts and skin abrasions, from handling animal carcasses, placenta, or contact with animal vaginal secretion. The second one type of transmission is the direct conjunctival inoculation. The third one is the inhalation of infectious aerosols. The fourth one mode of transmission is the ingestion of contaminated food like raw milk or unpasteurized milk, cheese made from unpasteurized milk, or raw meat. It means the infected animal meat. The last one is the viral transmission has been suggested, but the data are not conclusive. Incubation period. Acute or subacute disease follows an incubation period which can vary from 1 to 6 more or 6 or more months. And most patients for whom the time of exposure can be identified, the incubation period is between 2 and 6 weeks. The length of the incubation period may be influenced by many factors like virulency of the infecting strain, the size of the inoculum, the third one, route of transmission, and resistance of the host. Portal of entries, how it will enter to our body, like oral entry, aerosols, percutaneous. Oral entry, most common route, ingestion of contaminated animal products, often raw milk or its derivatives, contact with contaminated fingers, and aerosols, inhalation of bacteria, contamination of the conjunctiva, percutaneous infection through skin abrasions, or by accidental inoculation. The clinical manifestation of this disease will be fever, night sweat, malaise, anorexia, arthralgia, fatigue, weight loss, and depression. Clinical manifestation, the prevention of the brucellosis is characteristically variable. The onset may be insidious or abrupt. Influenza-like with fever reaching 38 to 40 degrees Celsius, limb and back pain are usually severe. Night sweating and fatigue are marked. Anorexia, weakness, severe fatigue, and loss of weight, depression. Headache. The leukocyte count tends to be normal or reduced with a relative lymphocytosis, relative leukopenia, or physical examination. Splenomegaly may be the only finding. Clinical features often fits one of the three patterns: febrile illness resembling typhoid, less severe, fever, and acute monoarthritis, hip, knee, young child, long-lasting fever, hip pain, older man, travel to an endemic area. Endemic, there are three terms like the endemic and pandemic and epidemic. But if a person travel to an endemic area, and occupation, it also depends on the occupation. Consumption of the unpasteurized milk will cause the brucellosis. Systemic infection with brucellosis like osteoarticular disease, especially sacroiliitis, 20 to 30%, and vertebral spondylitis, large joints, are affected most commonly in children. Genitourinary disease, especially epididymoarthritis, 2 to 40% of the males. And the third one is the neurobrucellosis, usually presenting as meningitis, 1 to 2%. Less common neurologic complications include papilledema, optic neuropathy, radiculopathy, stroke, and intracerebral hemorrhage. Now, coming towards its treatment, drug against Brucella, like most of the antibiotics effective against the Brucella species. Tetracyclines, aminoglycosides, streptomycin since 1947, gentamicin, natilmicin, rifampicin, quinolones like ciprofloxacin, and third generation of cephalosporins are most effective against the Brucella species. Antibiotic therapy, there are two major regimens. First one is the doxycycline, 100 mg orally twice daily for 6 weeks, and streptomycin 1 gram intramuscularly once daily for the first 14 to 21 days. The second one is the doxycycline, 100 mg orally twice daily plus rifampicin 600 to 900 mg 15 mg per kg orally once daily for 6 weeks. For more information about the brucellosis, I will discuss in next lecture, and you don't forget to subscribe, share, and like and comment on the channel for more information. Thank you so much for listening me.